press Alternate and Enter keys together on your keyboard for a better viewing of this presentation. Again, please press Alternate and Enter keys together.
Here is another example. This government statement reads that asthma can be controlled if new patients receive the appropriate medication. And the data shows that almost 1 in 3 patients is not getting that appropriate treatment, putting them at risk of asthma exacerbations. And in some areas in the country, it is as bad as 5%, that only 5% people, that is 1 out of 20, is getting the right treatment for their asthma. Now this is another sad story. This is a group of patients who already had a heart problem, like a heart attack or angina or something. Even in those patients, less than 50% patients in the US have a good cholesterol control. The remaining are at an increased risk of developing another heart attack, stroke, or other medical problems like peripheral vascular disease. I emphasize these are the patients where the patient already has a heart problem. In those who do not have a heart problem, you can imagine the numbers. This is another shocking statistic. This data shows that in the US as a nation, where there are 8 million diabetic patients, 2 out of 3 patients are not getting good diabetes control. And one thing I would like to point out, that the levels they have taken here as good control are themselves bad levels. Normally, for diabetes to be well controlled, the level of A1C should be below 7, and most of these studies are done with levels of below 9. So if you take the real level of below 7, where the complications can be minimized, the outcomes are still worse. Maybe 1 in 10 patients is getting the right control. The poor control leads to all the complications that we know about diabetes: heart problems, kidney failure, blindness, loss of legs, loss of feet. And again, read the government statement just above this study. This is New York State's report on managed care companies, all HMOs, and you can see the results individually. This is a shock, because these are the patients who go to the doctor but still are not well controlled. In some places, this is as bad as 1%. That means 1 out of 100 diabetic patients is under good control. Now this is another sad story. I would request you to read the government statement, which says people with diabetes are at high risk for an eye condition that may lead to blindness. For 12 years plus, we know that the diabetic patient must visit an eye doctor, and at least for 6 years the recommendation is that they should visit the eye doctor every year. When the government looked at the data, that did the patient see an eye specialist in the last 2 years, look at the such a poor data. Less than half the people had an eye exam. That means more than half the people are at risk of blindness because they did not go to an eye doctor. In some areas, it is as low as 19%, means 1 out of 5 persons had the recommended eye exam, and 4 out of 5 people are at risk of blindness just going along. If you look at the yearly data instead of every 2 years, it is even worse, and the recommendation is for eye exam every year. Even with this data, for every 2 years, 4 out of 5 people in some parts of the US are waiting to turn blind. Did anybody tell them that? I am not sure, I don't know. But I know one thing. We can tell you what is missing from your care, that you won't be the last person to know the complications of your medical condition. We can help you. We can help you address the gaps in your care as per national standard guidelines. Guidelines which are made by hundreds and hundreds and hundreds of consultants and specialists putting their brain together. You can see the whole report by going to New York State Government website and looking for HMO report for 2005.